feel like your face could use some freshening up? Many of us want that beautiful glow, but we're just not sure how to get it. So joining me today to provide a few suggestions, Dr. Timothy Treese from Columbus Aesthetic and Plastic Surgery. Dr. Treese, thank you so much for joining me.
My pleasure, Gail.
Now, I just started off because you talk about facial rejuvenation.
Yes.
What does that actually mean?
Well, the term basically means any of a spectrum of procedures that can be offered through dermatologists or plastic surgeons' offices. We like to try to give as little as possible to help people as much as possible, and so part of the real trick is picking out what procedure to use for what patient. So anything from a good skincare program, combining it with some of the vitamin A derivatives such as retin A, or moving on to skin peels that are more advanced, to any of the surgical procedures that we have.
So they all cover an umbrella of, will you call them non-invasive procedures, because you're not actually cutting into the skin?
In part, that's what it is, but they meld nicely into the surgical procedures as well, in the sense that everyone's needs are different. And we try to talk to the patient. That's one of the very fun parts of my job, about what exactly their goals are. So for some people it might be helping them with their skin care. For some it might be adding a little BOTOX or Restylane or Juvederm. And for some it might be more of a surgical technique that provides them with their goal.
Is it a little touchy when someone says, okay, what do I really need? You want to be honest.
That's true.
And you don't want to hurt feelings, and yet some folks may not need everything they think they do need.
Absolutely. And so I start things by first getting to know the patient, because many people do have unrealistic expectations, and that's the benefit of having a good board-certified plastic surgeon to talk to you about what you can, and more importantly, what you can't do.
And what it's going to look like afterwards, and what you think it's going to look like afterwards.
Correct.
You know?
Yes.
What about something like BOTOX, which is non-invasive?
Yes.
It's been around for a long time. I know it's been studied, but do we know long-term effects of BOTOX and other things that we're doing and ingesting in our systems?
At this point, BOTOX has been used for approaching 20 years in the neurological patients.
I didn't realize it had been used that long.
Oh,
wow.
It's been used a long time, and extensive studies have been done. And all of the scientific, prospective, randomized studies have not suggested that there are any medical problems with BOTOX. And I think that's part of the reason it's become so popular.
And as more expensive and more less expensive, as more and more people do it.
True. And
easily accessible. And now you combine it with other things. So give me some examples of how that works.
Well, one of the most common things we do is to combine BOTOX to try to smooth some lines, especially the frown lines we get here, or sometimes the little fine lines we get around our eyes, with a filler such as Restylane or Juvederm, which helps to just plump the skin up a little bit and provide a little bit more of the elasticity we had when we were a few years younger.
Do people use collagen anymore?
Not really. The collagen's not been as good, not been as long-lasting, and it's not as safe as the new products.
Oh, really? Because isn't collagen actually part of the body, and I would think that that would actually be more safe.
Well, true, but the Restylane and Juvederm are made from hyaluronic acid, which is a natural ingredient, and it's made synthetically, so that it doesn't have any of the animal proteins that the collagen used to have. So there are not the allergic reactions that we used to need to deal with.
Let's talk about downtime for some of these procedures. Less invasive, less downtime.
Correct.
And give me some examples of, if you do a facial peel, how long you would be out, or would people notice your skin is red or peeling?
Well, at our offices we have an esthetician who has patients all day long, and she does a variety of different depths of peels. If they're deeper, we help her. But the bottom line is many people go right back to work after having a facial treatment. If we're doing a little deeper peel, you might need the weekend off. But again, it depends on the problem, and if the problem is more involved, the solution is more involved, and the downtime's longer. Almost everything we do gets you back to work within 2 weeks at the very most.
Really? Even when you do surgeries, full facial things?
I have people that go back to work in less than 2 weeks all the time. And I think it's partly because the techniques are more advanced, and because we pick people who are in reasonably good health. And we have some nice ways to help you get back to camouflaging a little bit of bruising if it's there.
It's interesting that you said reasonably good health. There are other factors that people have to consider before they have this kind of surgery.
Absolutely, yes.
And that's one of them? I mean, do you have a whole list of, this is an elective surgery, so let's make sure you are good enough to have it?
Well, one of the things that I try to help people with is, hey, if we're going to try to help you with some techniques that I have, you do your part as well. And we run through a little let's get healthy checklist. So, you don't smoke, take a little better care of yourself with regard to ultraviolet exposure, have some reasonable exercise, all the things that make sense, but help keep your face looking younger as well.
Very good points. Dr. Treese, thank you so much for joining me. Good stuff to know.
My pleasure.